All right. So, Commissioner, good morning. It's August 2nd on Sunday, and I think this is a first for us. I am home filming from my couch, and you are actually in your car this week. Yeah, maybe a little explanation is in order.
The remote environment, let's just say, creates quite a few challenges, which I'm sure all of our staff who are teleworking can relate to. Just being home and competing with other things happening in the background. This has to be our filming studio today because it's quiet out here. So let's just go with it. We're all just trying to make it work.
We certainly are. So, why don't we hit a topic right away? Speaking of making it work, there's been a lot of questions about out-of-state travel
hmm
for the youth in our care and custody. And we'd like you to expand on that somewhat for our staff and our community partners who are going to see this video.
Yeah, so the summertime always comes with questions about travel. This year, along with everything else that the pandemic has turned upside down, is unique in that, there's some questions as it relates to traveling outside of Connecticut. So, we've charged Bureau Chief Tina Jefferson and the Assistant Chiefs of Child Welfare to make those decisions about kids traveling with their foster parents out of state. A lot more planning has to go into the logistics of all of that. And so that's where the decision making goes as far as travel out of state.
Mhm. Now, there is a higher level decision, Commissioner, that actually you are going to make as it pertains to our youth who are scheduled to go to college this month. And unfortunately, some of our youth were planning to attend school in one of the states that were subject to or named in the hot spots per Governor Lamont. What is the thinking there and the decision making for youth going to college?
So this was another one of those decisions that took a lot of consideration and a lot of thinking through, examining the metrics every single day, looking at those other states, looking at the precautions that our governor has taken with regards to people returning to Connecticut. And there have been 34, I believe, states
Yep.
that are considered hot spots right now. And so I had to make some decisions related to kids who are going to school in places right now that are in the bullseye of virus transmission. So I made the decision late last week to decide that our kids that are in college in those locations will be 100% virtual in terms of their remote learning. We would not feel comfortable from a safety perspective allowing kids to go and resume in-person classes in those areas because they're just, the safety considerations are really, really great. And of course, there's always extenuating circumstances and extreme situations that we can handle on a case by case basis and, really talk those through. But as of right now, any kid that we have that is a student in a college in a hotspot, we're asking and expecting that they be educated through the remote and online courses that are offered through those schools. The balance of that is also making sure that they have the appropriate technical support
Yep.
from our folks in the post-secondary ed division, along with our transitioning youth for success, working alongside of our child welfare folks to make sure that they are, supported through technology, supported through maybe extra tutoring or somebody that might be able to help them with navigating an online course load, and then certainly the social emotional cost of being in back here instead of on campus. It's a really hard decision to make. I had to make it for my own kids, and as the person who is charged with statutorily making those decisions for kids in care, I had to think about it as if they were my own, and it's tough. It's really, really tough. That could change a month from now. It could change 2 months from now, but as of today, the metrics are telling us we need to proceed with caution.
Yeah. And we've mentioned states on the quote hotspot. We're going to include a link to exactly what those 34 states are with a written memo that's going to accompany this video. And this past week also saw yet another point in time where you collaborated with the commissioner of the State Department of Education and his staff regarding schools reopening and parameters and looking at the impact of schools and children being in classrooms or not, and some of the potential impacts on the department, which was interesting because in talking before we actually started filming today, that conversation with the SDE then also turned into a discussion about equal yet equitable support. So what could you tell us about those continued conversations with the State Department of Ed?
Yeah, they've been great. Commissioner Cardona's deputies, Desi Nesmith and Charlene Russell Tucker, have been fantastic in really just helping us think through some of the ways that the State Department of Ed and Department of Children and Families can work jointly together. You know, our own school superintendent, Matt Folan, and Deputy Commissioner Michael Williams, joined with our conversation with CSDE to really think about honing in on making sure that districts are clear on the difference between educational neglect and truancy in these times, how they are going to be measuring absences, any unique circumstances as it relates to foster families, because, a foster family could have several different kids in their home from several different districts. And if each of those districts are making different decisions, where does that put us in helping families figure out their day-to-day experiences? We were thinking about things like, there's a difference between homeschooling your child and remote or distance learning. Homeschooling, it's the responsibility of the parent to come up with the curriculum and ensure that there's that, balance of the core material that a child has to learn based on their age level. Distance or remote learning, it's the responsibility of the school district to come up with what those parameters are and then to measure whether or not kids are getting it. So there's lots of nuances to this whole thing. Connectivity, who has connections, who has Wi-Fi access, in some households we are hearing that there may be one device and you have a high schooler, a middle schooler, and everybody's trying to get their work done. And it becomes a challenge for families to really try to figure it all out. And we just need to see where DCF and the kids that we're responsible for fit and all of that. And so, State Department of Ed has been really great at helping us work through some of those things. And as you're right, Ken, when you think about issues of equity and equality, this is one of those areas that smacks right in the middle of all of that. If a parent can make a decision as to whether or not to send their child to school because of safety reasons, does that parent make that decision because they can? And some of our families, will have to make a decision between whether they can go to work and put food on the table or whether or not their kids can be educated. And that is, something that a parent shouldn't have to make a decision on. So, the equity and equality as it relates to, all of the disparities and disparate outcomes that we've been talking about over the last few months in earnest come through loud and clear as you make decisions around this. We have our own in-home group of folks working on just flushing through some of that, so we make sure that we can have a clear picture that we can continue to talk with SDE on. That whole issue of equity and equality was highlighted this week in the last spotlight that came out, and how some of our providers have worked with our staff to make sure that outcomes for kids and families, fall along those lines.
And so that Spotlight on What's Right is our monthly newsletter. It came out actually Thursday morning. The focus of this month was really partnerships and how the department collaborates with community partners, both contracted providers and those providers that are established within our local communities that don't necessarily receive funding from the department. And we had 3 staff who shared their stories with us about just unbelievable outcomes for children and families, the result of those ongoing partnerships, the result of equity supports being provided to both individuals, adoptive families, to both keep kids at home, return kids, and actually have a young man adopted one day before his 18th birthday, which was absolutely remarkable.
It's people, doing what they can to make it work. You know,
Yep.
we started this conversation today with, you know, where I am today, and it's the unique circumstances in each of these cases. You know, providers have certain models that they have to follow, but you know, they know families, and once they get in there and start working with families, working in conjunction with our staff, they start to realize that some families have different needs, and some
Yep.
of the way that they deliver their services require for them to have a different level of flexibility in order to have those equitable outcomes. So shout out to who are the staff that were involved in those 3 stories. Cindy Putney, Lauren Papagoda, and then Heavenly Trinard were the 3 staff that were highlighted in those stories of just kind of unique, against all odds, you know, beating what sometimes people would see as barriers, but they
Yep.
actually turn them into ways of stepping stones for families. We worked really close with our court and judicial partners to get some of those things happening. You were talking about that 11th hour adoptions, and I think it's seeing each individual family and each individual situation for their own uniqueness and individuality. And, you know, that harkens back to the conversation we were just having about schools. You know, one of the things that came out of the conversation about thinking about what's needed for this school year, if you think back to the spring when we stopped school, or when school was stopped,
Yep.
teachers had like the whole year to get to know some of the kids in their classroom, and they were able
Yep.
to really hone in if a student was struggling in the first couple of weeks of distance learning, because they had a baseline. One of the things that came up in our conversations was, you know, they won't have those individual connections with kids, because if they start in a hybrid or in a totally remote environment, will they know who kids are, and will they be able
Mhm.
to identify if that child is in distress? So, you know, all of this speaks to our ability to meet families where they are, um, identify what their individual unique needs are, and then make plans that, you know, can be consistent, but also reflect the variability of what
Yeah.
families are experiencing in all of this. This has just been something none of us could have ever predicted, but we've seen people being very creative, innovative, and hardworking through it
Yeah.
all.
And it also speaks to a point that in each one of the stories that was highlighted, an individual in the story brought up the concept of it takes a village to
Mm-hmm.
raise a child, and
Yeah.
you brought that out as well in your message in our Spotlight newsletter. And I think, speaking of the issue with the teachers and knowing their kids or not having that ability, all of this really again emphasizes it does take a village to protect kids, to raise kids, to look out, and to support children and families. And those issues just keep
Mm-hmm.
coming up week after week. So, Commissioner, I think at this point in our video, you typically talk about statistics and those affected directly by COVID positive diagnoses. So I think if staff
Yeah.
want to, turn off the video now would be a good time to do that.
Yeah, let's shift our conversation to the numbers. Ken, as you know, Connecticut is one of the handful of very few states that has kept its transmission ratio and percentages down pretty low.
Yep.
Um, but what we started to see this week is a slight uptick in positive cases as it relates to teens and young adults in general in Connecticut. So, you know, we want to be mindful, of course, where that intersects with the work that we do. So we added 2 more COVID positive youth, which makes 20 youth who have tested positive in our data. We've had 36 staff members who have tested positive. That's plus 1. Oh, no, I'm sorry. That's with 35 having returned to work. We added an additional foster parent, bringing that to 49 foster homes who have experienced a COVID positive person in their household. So these numbers, although steady, still reflect that we are not out of the woods, and
Yeah.
that, you know, we still have to remain vigilant. We are, you know, surrounded by luckily other New England states who are still pretty low, but then we just heard that Rhode Island is starting to tick up. So we just have to remain really cautious, really vigilant, and you know, all the things we talked about this week on in our planning for school, whether it's, you know, kindergarten through 12th grade, or it's our kids that are going to college. There's lots of stakeholders and lots of decision points that go into making a public health decision along with balancing the mission critical needs of the department.
And just to confirm, Commissioner, I think you said 49 foster parents. It's actually 69.
Oh, I said 49.
Yeah.
No, I mean 69.
Maybe it's
69.
the way I heard it, but just to clarify one more time, it's 36 staff, 20 youth. We added a few youth to that number. The staff number is held strong, and we've added one foster parent, so it's
To make it
69.
69. Mm-hmm.
Yeah.
Yep.
Yeah.
And so that's our data for the week. And that's also the updates that we have, and, you know, continuing to just be proud of the work of the department and all of our staff who are just trying to get it done.
Absolutely. So
Right.
enjoy the rest of your Sunday. Hopefully
You
you
too.
get out of that car soon, and we'll see you tomorrow.
All right, Ken. Take care.
Take care, everybody.